Dr. Petersburg, how are you today?
I'm doing well. How are you today?
Good. I'm Dr. Ben Reeves, an associate of the Naturopathic Medicine Institute, or NMI, and I'm working toward my Vitalist Fellow Track certification. The NMI envisions a world where enjoying optimal health allows people to reach their highest potential for inspired creativity. It asserts that the highest ideal in healthcare must act in concert with the healing power of nature. And today we have NMI Associate and Certified Vitalist, Dr. Nate Petersburg, joining us to talk a little bit about the history and science behind warming socks or magic socks or wet socks. There's a lot of references by different names to this treatment. But before we get to this topic, which we're both really excited about, Dr. Nate, would you please tell us a little bit about yourself?
Sure. I graduated from Bastyr University. I still live in the Seattle area in Kenmore, which is near the university, actually. I moved out here for school from Tennessee, actually one of the few states where I'm not allowed to go back. I moved out here with my wife. I currently run my own practice called Created for Health, and I'm also adjunct faculty at Bastyr University. So I get contact with students and in the classroom every week, and also with my patients every week. So it's keeps me very busy, but it's a real joy to see both sides of it, to see the new students learning and to also see the patients and just see how their lives change and what vitalistic medicine can do for them. So I talk about this stuff all the time.
Well, that's a great segue into our topic. It seems most natural to just talk about what is the wet socks treatment. Maybe you can walk us through the classic version of it.
Sure.
What is it? What is this magic socks?
Magic socks. I like that they sort of changed the name to magic socks. Because otherwise you tell people, oh, I want you to put cold socks on your feet. And everybody cringes back and like, no, I will never do that. But what we are doing is taking a pair of cotton socks, getting them in cold tap water, no ice, just cold tap water, putting them on your feet, putting a pair of wool socks over it, and going to bed. One of the hitches, not hitches, that's a bad word. One of the things we always need to remember when we're doing hydrotherapy, whether they be wet socks or any other type of hydrotherapy, the patient needs to be warm first. Just because you have a fever doesn't necessarily mean you're warm. You could be very chilled when you have a fever. So the patient needs to be warm, or at least feel like they're warm. We can warm them up with running their feet under a hot tap water first in the bathtub, taking a hot shower or a hot bath, or sometimes, just even warming up in bed for 20 or 30 minutes beforehand. So you have a little bit of body heat and what I would call vitality already built up. Then we take our cotton socks, we stick them in cold tap water, you wring them out real well, you don't want them dripping, and then we slip them on the feet and the pair of wool socks over the top, and then you climb back into bed as quick as you can. I know it sounds awful. Everybody cringes. And then those who are brave enough, or I'll say it, almost wise and smart enough and brave enough to do it, recognize they get great results. It is not nearly as horrific as it sounds. They warm up quite quickly. Most people fall asleep within a few minutes of having them on as well, maybe 5 or 10 minutes. Some people, if you fall asleep quickly anyways, probably even just as quick. We tend to use just our plain normal cotton socks, probably just past the ankle, maybe mid-calf, which is great. It serves a wonderful purpose. It's very interesting in Germany, where a lot of this stuff develops. They do sell actually wet socks.
Oh, really?
Well, they're not actually are pre-wetted or anything like that, of course, but they're knee high. They will come up all the way to your knee. It is a pair of linen stockings, and then a pair of wool stockings that slip over top, and it goes from your toes all the way up to the kneecap, which is an interesting way of doing it. Probably a lot stronger reaction to the body, but why buy a pair of linen and cotton stock or linen and wool stockings when most of us already have them at home?
So you're saying in Germany, they actually have socks made particularly for this treatment?
They do. You don't find them everywhere, but there's a few places. We do a hydrotherapy experience trip every September. And one of the towns we go to is Bad Wiershofen, where Father Sebastian Kneipp, one of who we would say is one of the grandfathers or early naturopath. Well, he wasn't a naturopath, but helped bring naturopathic medicine to the States through him healing several people who lived here. This town is where he lived and died and where he practiced. And so there are lots of opportunities to see the way it develops there.
Quick little question for you. If let's say the child or the adolescent has a mild fever already, so they're a little bit warm, would we still want to warm them up, with, I guess they could have fever and chills, but let's say that they're already a little febrile. Would that be sufficient to start the treatment, or would you still recommend that we get them even warmer?
In general, I still might put a little warm water, at least on their feet. I may not put them in a bathtub because we don't want to elevate that fever with a hot bath, but a little hot water or even just warm water on their feet, just to make sure, especially if it's a little child that, maybe is just feeling crummy and isn't very talkative. And it's always going to be best to make sure they're warm. So a little hot tap water, slip the socks on their little feet and back into bed. They'll probably dislike it. They'll probably dislike the hot water, and they're probably going to scream with the cold water. But they also settle down very quickly. So don't be afraid of a little bit of aggravation, as we call it.
Now, I know that I'm really excited to get to the science behind it, but you've touched a little bit upon Father Sebastian Kneipp and a little history in Germany, but do you have any idea where this treatment first started, or where we first have a record of it? Tell us a little bit about the history.
Yeah, I tried to do a little quick looking on where it first came in. I may have looked on the wrong places. Maybe you have found something, but I didn't find exactly where it came from. But it basically develops out of what we call a wrap. And that was, I'm sure people did it before this, but we sort of link hydrotherapy wraps to Vincent Priesnitz, who was, I think he died in the 1700s. I could be off on my dates a little bit, but he's who we kind of credit with developing wraps. And then Father Sebastian Kneipp really continues the idea of the wraps. Yes, it's a sock, but it's still wrapping a part of the body. I joke with the class that I teach that a wrap is a wrap because it's a wrap. And if you have a part of the body, you can wrap it.
Right.
So a wrap could be around your foot, around your leg, around your whole body, or around your neck. And it just develops. It's easy to do socks because we already have them pre-made.
Now, is that synonymous with a compress because there's some compression taking place, or is a compress different than a wrap?
I would probably argue a compress is different. There probably would be some that would maybe have a little finer tune of the syntax and, what the words mean. But I think of a compress simply just being a cold, if we're thinking cold, a cold towel on you, and then it warms, it gets removed. Okay. Whereas with the warming socks, we're going to leave them on all night, or at least until if somebody wakes up. If you wake up with the wet socks on and they're good and dry and you're very warm and kind of sweating, we encourage you just to pull the socks off and then fall back asleep. Some people won't wake up at all, and we'll just simply wake up the next morning. The socks are dry, the socks are warm, and then you start your day. I'm going to say 99%, because there's probably always that 1% out there who don't sleep better, but 99% will sleep so much better. And so I would argue a compress is we're just letting it heat up and then we're removing it. Okay. Whereas with a wrap, we're allowing the body to sit longer with it.
Okay. So going back to what you had said about, the history, did it then originate in Germany, or is it just something that goes way back and we just get that lineage from Germany?
I'm going to hedge my bets and say we get the lineage from Germany. I can't imagine that there weren't other people who took a piece of wet cloth and wrapped it around a broken bone or something. But as far as, our lineage as naturopaths, or what we would call hydrotherapy, even Sebastian Kneipp didn't come up with this on his own. He found a book that was written about it from the early 1700s. Right. Where did Priesnitz come up with it? You know what? I've not been told a good answer on that one. The theory is he just watched animals dipping wounded appendages in cold water, and
Mhm.
he had a broken rib, and the best way to get cold water on a broken rib is with a wrap.
Yeah.
Um, so I'm going to go ahead and say that's where we get our lineage from.
Yeah, there's almost an archetypal element here. I mean, it's,
Mm,
it's referenced in scripture. These bandages in water for wounds, and I mean, it's obviously something that goes back centuries. And
yeah.
um, well, let's get a little into the science now. I mean, I know there's quite a bit going on here, and I've talked to people before. They're like, what is this woo-woo treatment? They think that it's some kind of magic thing, and I'm like, no, this is actually physiology. This is science. But I find myself often at a loss to explain it very well. The vasodilation, the vasoconstriction. Maybe you can walk us through a little bit of the physiology and the science behind it.
Sure. Yeah, there's definitely vasodilation, vasoconstriction. We can even throw out other big hydrotherapy type terms of derivation and retrostasis, and
Oh,
um, but even for the hydrotherapist, it's simply either drawing or in our case, drawing blood, but you could also drive blood away from an area.
hmm
So if we're talking our socks, we're putting cold compress on our feet.
hmm
The immediate reaction of the body is vasoconstriction,
right,
bringing the blood further into the core of the body or further inside the foot.
right.
That's the immediate reaction. Everybody's going to be a little bit different, but anywhere from a few seconds to a few minutes later, the body is now going to vasodilate and shunt that blood back to the surface, trying to warm the area. In doing that, we're also encouraging the body to draw down blood into the feet. We're not removing any blood from the brain or the upper body. We're not, shunting blood so we can't think or anything like that, but we are drawing blood down. So we think of it oftentimes when we have head colds, congestion, postnasal drip, those things that keep us awake because we've got all this congestion. A nice way to do it is to draw that extra blood down out of the head by putting cold, wet socks on, and it can help dry up that extra postnasal drip and allow us to sleep and ultimately heal. If we're not sleeping, it's hard for us to heal. Our bodies need that rest. So yeah, it's the initial vasoconstriction and then that dilation, and it just, by leaving it on there longer, the body really warms.
So basically, as the vasodilation is occurring, as the blood vessels are swelling and blood is pooling in the lower extremities, that that thereby blood is drawn down. Is that, I mean, is that fair to
That's a
say?
great way to put it.
Some of
Yep.
that blood is going to come from the upper extremity, and it's almost like gravity is pulling it down. Is that really what's happening?
Simple enough.
Yeah.
Yeah. I know we want some big, huge scientific, and we don't really need a research study. Physiology's already worked it out for us. Our bodies got great function and design. And you put, for example, if you were even to put your hand in cold water or even around a cold ice glass of cold ice water in the summer, your hand's going to initially get kind of cold. And now, yes, it's a pretty intense cold. It will take a while, but your hand will slowly start to warm that glass, and your hand will start to warm back up as that blood comes back to the surface to try to warm itself. The whole idea with hydrotherapy is, one way of saying it is homeostasis. Another way of saying it would be heat regulation. The
Hmm.
body doesn't do well in either extremes. We don't do well in Antarctica without a whole lot of clothing and support. And as we get to the really hot temperatures, we don't do well.
Right.
So we try to constantly regulate the body's temperature, the body's natural heat regulation. And so that's really what we're trying to do with hydrotherapy. Isn't just using cold, it's looking for that reaction. The body has got a secondary reaction. The initial reaction is that vasoconstriction, but we want that vasodilation, the body's reaction to it. So we train the body better. And
Right.
so we look for that secondary reaction and a heat regulation.
Now, I mean, this kind of gets into the philosophy of vitalism and thinking like a naturopath, and this is the really exciting stuff. And this may be a little more advanced for some people, but this law of dual effect that you're referring to. Now, the secondary reaction, isn't transient, right? It's more long lasting. And I guess that my question to you is this secondary vasodilation we're seeing, is it actually a more long lasting and less transient event that's happening in the lower extremity? Is this like a perfect example of the law of dual effect?
I
Or,
think it is.
yeah,
If you put those socks on and you're able to sleep through the night and you find yourself warm, okay, yes, we will get warm in the bed naturally. I get that. But some
yeah,
people will actually start sweating. For example, well, if it's okay to use myself, somebody, we don't I encourage this only to be used when there's a ankle or foot injury or an illness.
mhm,
Some people sometimes suggest it for insomnia, and for some people it works. One of the possible side effects is if you're not sick, a little too much heat, and you can then really start to increase the sweat.
mhm,
Several hours later, you might wake up thinking you just had night sweats and you've sweated through your pajamas onto the sheets
right.
just from wet socks. And so there is a long-term effect. Can we
Mm,
argue that that lasts now for days and weeks? No, the body needs training and retraining.
right.
And it's one of the fun things about hydrotherapy is that it is training the body for it to work naturally and as it's intended. And for some people, one of a frustration because it's not, if you do wet socks once, yes, you'll start to sleep. But if you're trying to train your body just like a gym, you can't go to the gym once every 6 months and expect to be in good fitness.
Right.
We're training the body every time we do this.
So that kind of gets into a couple of, well, first of all, I want to ask you, what other things can we use this to treat? I mean, obviously we've talked about congestion, postnasal drip. We've talked about the cold and the flu, uh, having a fever and all the accompanying symptoms of that. Calming down, I guess it could help calm a person down, but what else could we use this for?
I sort of mentioned it just really in passing, but sprained ankle, foot injuries. Um, it's a great way to be shunting that blood, that vasoconstriction dilation. As we're doing that, we're bringing normal, and if there's an injury, then the metabolic waste of repairing. We help to get that waste product out, and we're bringing fresh blood and lymph fluid and nutrients and oxygen to the area. So we're able to help heal the tissues. Yep, insomnia or just calming down. I might encourage somebody if they were using it for that. Maybe you're not going to bed, you're just going to take a nap or rest for a little bit. That's your way of just relaxing rather than, maybe risking waking up and now you're in a panic because you're all sweating.
Right.
But, early evening, you finish dinner and somebody, they know they're very anxious and maybe they have a busy day ahead and got to give a presentation on Facebook and like I'm a little stressed out, and just do a nice little cold wrap on your feet and see if that doesn't bring down that anxiety and relax the person.
That's great. I'm so glad we're talking about this because it's something that I wouldn't think of. Like, oh my gosh, this is something we could prescribe to our to a patient for anxiety or insomnia. It's or even to myself to calm myself down. Um, Now, the books, for example, Andre Sen's book with Wade Boyle about hydrotherapy, it talks a little bit about, immune cell counts going up, the immune system being boosted, energy levels going up, stress being reduced. Can you talk a little bit about the science behind that? I know we've touched on it a little bit, but how is the immune system boosted by this treatment?
Yeah, the body's still reacting. Maybe this isn't the best way of describing it, but can almost think of it. If I can also maybe bring in another modality that we tend to use of homeopathy, the body sees things as a threat, and we're actually using the cold water almost as a threat to the body, and the body's got to react to it with that physiology. The body's also perceiving the threat, and so everything, we're not disconnected. My foot's not disconnected from my heart, from my spleen, from my immune system. We are a complete person, And so we affect just the blood vessels. The blood vessels are still going to affect um, uh, the areas where we're, our immune system.
Gotcha. That kind of or ties in with that we could use homeopathy with this treatment, right? I mean, if the patient's presenting in a certain way, like a belladonna type way with hot, red, throbbing face or extremities, we could give a belladonna homeopathic and then do the wet socks treatment, right? Or if
Exactly.
a child's in a chamomile state and they're irritable, and we could give them a chamomile remedy and then give them the warming socks, right?
That is exactly right. We can use, that's the beauty. That's what one thing I love about vitalistic medicine is that we can use just one modality. We can just use a remedy. We can just use hydrotherapy. But we can also use all of it together. At the last conference, the Vital Gathering, a bunch of us were at, we used the example of a horse-drawn cart. And if you need 6 horses to make that cart move, why would you dream of using 1, 2, or even 4 horses if you need 6? Not everybody's going to need 6. Some people will just need 1 or 2. And getting to know your patients well and spending that time with them, you get to kind of know what they need. And then that way we can give them exactly what they need. Or even if we know they only need one thing, we can still support the body a number of ways to get them back quicker. Yeah, we don't want to have that lost work time, but you know what? I said this to a patient the other night. I don't like to miss work either, but you know what? When we're sick, we just need to rest. The body is telling us what we need to do.
Right. Well, Dr. Nate, thanks so much for taking time out of your busy day to do this interview. Um, I want to respect your time, and we're kind of wrapping up here, kind of running out of time. Is there anything else you want to say about this amazing treatment or about vitalism before we close?
I think simply that it's that simple and that complicated, right? It's like so many things. Anybody can do hydrotherapy, and yet there are thousands of pages written about it, and lots of hours of training and work into it. And you can do it at home. You can do it in the clinic. Vitalistic medicine is about getting the body to respond, getting it back to normal function and design and health. And we're just here helping to guide the body. The body's ultimately doing all its own work.
It's great. You've made me realize that this warming socks treatment is like the perfect metaphor for what we do. I mean, it illustrates so many things. It illustrates the vital force. It illustrates the law of dual effect. It illustrates how the body's working and responding. I mean, I'm not being very eloquent here, but it's a perfect portal into what we do. And
it really is. It really is. Yeah. No, I can't stop talking about it. I talk about it with all of my patients constantly in the halls at school whenever I'm on campus, and well known for that.
Well, I'll make sure that there's a link to your website, at the bottom of this video. And thanks so much, Dr. Nate. I think it's time to wrap up. Thank you so much for taking the time to join us today. And if you want to learn more about how to become an associate of the Institute, the Naturopathic Medicine Institute, that is, go on over to naturopathicmedicineinstitute.org and watch for the upcoming events. Get in touch with us. At the NMI, the laws of cure are seen to be immutable, and the healing power of nature is acknowledged, discussed, unpacked, and celebrated.